It's such an honor to have you here and privilege to be able to talk to you today. And I appreciate also the opportunity from the college to have these interviews. I think they're good for all of our members and also hopefully will increase interest in all the amazing sessions that we have in the Congress that are also for free. My name is Paula Ferrada. I'm a professor of surgery at Virginia Commonwealth University. I direct the fellowship for critical care and trauma, as well as the surgical and trauma ICU. So welcome, Dr. Roser. It's such a pleasure to have an expert on Airway, your OMFS, and you're going to lead this session in emergency airway. So tell us a little bit more about why everybody should take a look at your session. Why is it so important? Especially because airway emergencies are like the real deal. You either save somebody or don't, right? And it's like you have to think on your feet. So tell us a little bit more about the session and why do you think is so important that we all go?
If you listen to 55 minutes, including the questions and answers, you will come away with some really good insight into what to look for and what to think about. Not just when the airway emergency occurs, but prior to it, and prepare yourself for it.
It's such an interesting subject because at the moment there's so much adrenaline going on when you have to deal with an emergency airway, right? So I think that sessions like yours and the things that the great panel that you have selected kind of prepares you mentally. So you even though you have not done 1,000, because God forbid, right? But you know in your head what is the next step to follow. So what do you think is a wonderful panel, very diverse. Tell me more about what you thought it was so important to add pediatric and trauma in general and adult about the collaboration that is not only important for the panel but for helping these patients.
The workforce that got stood up for COVID came from surgery and anesthesia, not from medicine, although right. they were there. And I would tell you, airway and you know, the managing the respiratory tract was critical in this. And if you look at the outcome for those units that were run by surgery and anesthesia, and I can't let my medicine colleagues hear me, but the mortality and the morbidity from those were less than in the medical ICUs. I think that every surgeon, and you know, you could say, well, I'm a bariatric surgeon. What do I need to know about airway? Well, every time your patient goes to sleep and every time your patient wakes up, that is something you need to consider. Your anesthesiologist isn't going to establish the surgical airway for you. You need to do that. Your time is limited. And so what we tried to do was to look at what situations would general surgeons find themselves in. In the ED, a pediatric patient comes in with a foreign body. They're doing a hernia on a patient with OSA that's overweight. How do they stand up a group of people to work with them to respond to airways if they're the first responders? So these were some of the things we talked about and some of the things that we felt were really, really important. And the college did too, because they selected the program.